This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about when do you need stitches for a cut. So a good guideline is you need stitches when the skin has been cut deep enough that it separates open. Usually these are more clean cuts, although if you have kind of a jagged cut you can do it as well. But if you have a cut where it's deep enough that the epidermis has separated and possibly the dermal layer as well, and you can almost kind of push them back together a little bit, that's when you would probably need stitches. Normally to get them, you have to go to the urgent care or emergency room, and it'll be up to the doctor to decide, does this actually need stitches or does it not? If you have more of an abrasion where it's just more of like a loss of a big kind of chunk of skin, that's usually not so amenable to stitches because it's not like you can really bring those areas together to make them heal appropriately. So a lot of times that's just left to heal as is. We call that healing by secondary intention, meaning that you just leave it. And even if you have a cut that does need stitches and you don't put stitches in it, usually it'll heal like that as well. It just kind of creates scars, which most people don't like. So we try to put stitches in them. A few things to note: that this is assuming that it's just kind of through your skin and it's not hitting any nerves or tendons or vessels. So it's always good to have somebody evaluate that, especially if it's in the hand or foot or something, to see if you really cut anything vital. And then also, depending on what you got cut with, the wound usually should be cleaned out, or it should almost always be cleaned out. Now, some things are dirtier than others. If you step on a nail outside, that's a lot worse than if you just cut yourself with a clean knife in your house. So that may require antibiotics, or at the very least flushing the wound out. I use betadine, then I use normal saline solution. And if it needs sutures, I'll put some sutures on top. Another mistake a lot of people make, a lot of emergency room doctors make this, is they put too many sutures. So if you have a wound and it's dirty, it needs to drain. So what you don't want to do is put sutures like every millimeter or two, because it'll look really good and nice and tight, and then it'll get infected because the wound needs room to drain. So that's basically the rule of thumb of when you need sutures. If you have a cut through the skin and you can almost push the two layers back together, it would probably benefit from sutures. If it's a large gash where you really can't do that, then it probably wouldn't. But if you're at all curious, then it's really best to get it evaluated by a professional. So I hope I was able to answer your questions. If you have any questions for me that I didn't answer about when you would need stitches, feel free to leave them in the comments below. If you like this video, we put out new content every Friday, so please like and subscribe, and thanks for watching.